My name is Dr. Tom David, and I've been a dentist for 43 years. For the first 12 of those, I was a general dentist, and I started to get kind of bored with general dentistry, and so I decided to go down to the University of Florida and participate in a residency training for facial pain, and that kind of piqued my interest, and that's what I've been doing since about the early 90s. And over the course of almost 30 years now, I've been treating facial pain patients, and I find it rewarding and challenging at the same time. And this video is primarily meant to educate other doctors about things to look for, things that are not as important as they may think they are, but in general to give referring doctors a better idea about facial pain patients and what are good things to look for and things that you might think are important that may not necessarily be important. Good morning.
Good morning, how are you?
Just fine.
I'm Christine.
Hi. I've seen your daughter before?
Yeah, you saw my daughter Caroline.
Okay. Okay.
And relieved her TMJ.
Okay. So you're here for the same cure?
For the same cure.
I say that
yes.
reservedly because we really can't cure these problems. You can manage them. So what sort of problem are you having that brings you here?
My left jaw has been very, very sore to the point where I have to put my finger in my cheek to open my mouth to eat.
You mean put your finger in? Inside your cheek,
No,
or
press
on the outside?
It just kind
Okay.
of eases it open.
So how long has the left side been bothering you?
For about 8 weeks.
Okay, so fairly recently. Okay. So you have no pain on the right?
No, it just clicks.
I'm asking her if both sides are bothering her. And the reason I ask that is it's important to know whether the pain is unilateral or bilateral. And mostly one side is bilateral in my opinion. Strictly unilateral, I want to know, because if the pain is truly unilateral, then all of the ominous things are still in play, like a tumor, an aneurysm, things like that. So that's the reason for that question. Have your jaws ever gotten stuck open or stuck shut? No? Okay. Have you ever been hit hard in the head or the side of the face? Okay. Do your jaws typically bother you in the morning when you first get up?
All day.
All day, including in the morning? Mm-hmm. Okay. So there was a question about when the problem occurs during the day, and typically people with jaw problems, they may have the problem when they first wake up in the morning because of giving their jaws a workout at night, or it may get progressively worse throughout the day. So there's a question there about when they typically have their pain. Have you ever been treated for jaw joint problems?
No.
Okay. Are you having any problems with chronic headaches or earaches?
No.
So then there's a question about headaches and earaches, because both of those issues can be related to jaw problems. So I want to ask them about those. Certain types of headaches tend to be more related to jaw problems than others, and earaches can be related as well, although there is no way to directly test the relationship. But those are both relatively important questions for people with facial pain. Okay. Are you having any difficulties opening, closing, or chewing?
Opening.
Okay. There's also a question about, are you having any difficulties opening, closing, or chewing? Because in addition to the pain issues, there are often problems with opening your mouth, closing your mouth, or chewing food, which is an aggravating factor because putting your back teeth together is what activates jaw muscles. On a scale of 0 to 10, how much pain do you have right now?
A 2.
Okay. So I also asked them, on a scale of 1 to 10, how much pain do you have right now? And that's typically an analog scale question because I want to get an idea of how much pain they have on a relative basis. For instance, someone that has a 1 out of 10 has a low pain level, but more importantly, someone who tells you that they have pain that's 11 out of 10 on a 0 to 10 scale tells you that there's a psychological component to their pain. Would that number be typical of the average day, or would it be a different number?
It's 2 until I open my mouth.
Okay.
And then it's like a 4 or 5.
Okay.
It's not excruciating, but it's aggravating.
Okay.
It shouldn't happen to.
So it hurts worse if you open.
Mhm.
Well, just don't open.
Yeah, I wish.
See?
I'd lose weight.
We could have done that over. We could have done that over the phone.
Go over talk, yeah.
Okay. So the next question is about the duration of the pain, specifically whether the pain is there all the time or whether it comes and goes. It's more typical that the pain comes and goes, although if the patient says that the patient is there all the time, that's generally an indication that they've had this problem for a longer period of time. Is the pain sharp or dull or both?
Both.
Okay. And you said the pain is there all the time, is that correct?
When I open my mouth, it's always there. If I close my mouth, I don't feel right.
Okay. So there's sometimes you don't have any pain?
Right.
Okay.
But mostly if you talk or smile or eat, then I can tell it's aggravating to me,
Okay.
which is most of my day.
Okay. Does chewing aggravate the problem?
No.
Okay. But opening does.
Opening and closing do.
So closing as well?
Actually opening.
Opening. Okay. So the next question about what triggers the problem. And again, oftentimes chewing can trigger the problem because contact of back teeth is what activates jaw muscles. And many people will complain about problems chewing. So we want to find out if there are any specific triggers for the pain, but chewing is certainly a common one. Do you have a favorite side you normally chew on?
My left side.
Okay.
It's weird, I never thought about that till right now.
Okay. Are you having any problems with neck or shoulder pain?
No.
Okay. So there's a question there about problems with neck and shoulder pain because often people with face pain or jaw pain can have other complicating issues with neck and or shoulder pain, especially if the facial pain precedes the other, and then you start to compensate for the face pain and you may develop secondary neck and shoulder pain. Have you had braces?
Yes, 100 years ago.
As a teenager or as an adult?
Teenager.
Okay. Have you had any dental work in the last month?
No.
Okay. Any history of arthritis that you're aware of?
No.
Okay. So there's a question there about arthritis, and that's a relevant question because you can get arthritis in any joint, and that includes the jaw joint. And so one of the questions you typically want to ask a patient is if they have any history of arthritis, because if they do, they're more prone to get arthritic change in their jaw joints. And what are you taking a muscle relaxant for?
For my jaw, my general practitioner gave it to me.
Okay. Do you know which one you're taking?
It has a benzocaine. It starts with an O and has a benz in it. She put it in my chart. I can't remember the name of it.
Okay. More stress than normal over the past month or so?
Yes.
Okay. So there's a question about stress levels because stress can also trigger episodes of face pain. Typically under increased levels of stress, people will give their jaws more of a workout and it can create muscle pain associated with jaw function. Okay. Let's take a look at you. Okay. There's a headrest right behind you there. There you go. Put your tongue out for me, please. Okay. One of the first things that I ask the patient to do during the exam is to put their tongue out. And I'm not really particularly looking at the back of their throat, which is what most people think that I'm doing. But oftentimes people that have jaw pain may have difficulty opening. And if I specifically ask them to open, they may be very guarded about opening. So I want to see how wide they can open just by asking them to stick their tongue out. It gives me a better idea of whether there's any impediment to opening without putting them on guard. Close your teeth together for me. Okay. Open for me. And close. Again, open and close. Slide your lower jaw to the left as far as you can go. Part of the examination is a documentation of their range of motion. And I want to see not only how wide they can open, but how far they can move right and left and front and back. It's a pretty good indication of whether they have a normal or a less than normal range of motion. Back to where you started. Back to where you started. There you go. Close together. Okay. And now slide to the right and back to where you started. Close together. And slide forward as far as you can. Back to where you started. And open big as you can. Okay. Close and open. Okay. And close. Okay.
Did you hear the click?
We haven't gotten to that part yet. We're going to listen to your joints in a little bit. We haven't gotten to that part.
Exciting.
Open just a little bit. The next part of the examination is a joint palpation, and I want to see whether they have tenderness in touching the outside of the joint or pushing up, which would be loading the joint. And close. Stay closed for me. Any soreness or discomfort?
Right there.
Okay. And close again for me, please. There you go. Does it hurt around your ear on either side when I push up?
No.
Okay, open just a little bit and push your jaw straight out against my thumb. This next part of the examination is what's called a lateral pterygoid provocation test. The lateral pterygoid muscle is a muscle that has to stretch for you to be able to open, and it's located anatomically in such a place that you can't directly palpate it. So the only way to test whether it's sore is what's called a provocation test, because in addition to using it when you open, you also use it to move your lower jaw forward. And by pushing back against the lower jaw when a patient tries to move forward, it'll provoke the muscle, and if it's sore, it indicates that the lateral pterygoid muscle is indeed sore. Push out against my thumb. Hurt on either side when I push back?
Mm-mm.
Okay. Open for me. This next part of the examination is a test of whether pain that's elicited is muscle or joint pain. And I'm asking the patient to bite on a cotton-tipped applicator on both sides. And I ask them, when they bite on it as hard as they can, is there soreness or discomfort on one side or the other? And basically, same-sided pain or ipsilateral pain is an indication of muscle pain, and contralateral pain is typically an indication of joint pain. And close your teeth together. Bite down on the cotton hard as you can. Any soreness or discomfort?
Mm-mm.
Okay, open. And close together. Bite down hard as you can. Soreness or discomfort on either side? No.
No.
Okay, open. Open. The next part of the examination is to listen to their joints. And I'm listening for specific types of sound. Popping or clicking is typically an indication that the disc in the jaw joint is popping in and out of place. And the other sound that I'm listening for is crepitus, which is an indication that they may have degenerative or arthritic change in the joint. And close. Open. Move side to side. Okay. Open. And close.
Any soreness or discomfort where I'm touching with my fingers?
This next part of the examination is a muscle palpation exam. I'm palpating the muscles that are directly related with jaw function and indirectly related to jaw function to see if there's any soreness or discomfort in the muscles.
No.
Okay. And how about here?
No.
No soreness there? Tilt your chin up just a little bit. Any soreness where I'm touching now?
Nope.
Neck feel okay here?
Yes.
How about the back of your neck?
It's good.
No soreness?
The last part of the examination is what's called a trigger point palpation. If you put your fingers over certain parts of muscles that are directly exposed, you may feel a really taut band of muscle, and that's what we refer to as a trigger point. And those are basically hot spots that need to be addressed during treatment.
Turn your head a little bit away from me.
Ah,
Soreness there?
yes.
Okay. Soreness here as well?
A little.
Okay.
Yes.
Okay. Any soreness here?
No.
Okay. Okay. I'm going to make some notes in your chart back in my office, and then I'm going to come back in a few minutes and talk with you about some things, okay?
Thank you so much.
If you're more comfortable, you can have a seat.
This is great. I love it.
Okay. You can stay right there. I'll be back shortly. I want to show you something on here. She's complaining of joint sounds on the left-hand side. And when you look at the anatomy of the condyles, it should be fairly smooth and rounded, which is how the right side looks. But you see the little divot right there?
Yes.
See how there's almost a stair-step effect?
Yes.
That's what's going on with respect to why her jaw joint is popping. Because instead of being nice and smooth and rounded, there's a stair-step effect, and it tends to make the disc want to pop in and out of place. First thing I want to do is show you something on your X-ray. How long has your jaw been popping on the left-hand side?
I don't remember. On the right-
A long time.
Yeah, I think just every now and again, forever.
Okay. But a lot more recently?
My right one, both of them much more.
Okay. Okay. This is the area of the jaw joints here.
Which is my left?
This is your right,
Okay.
where you see the R, this is the left. And basically, this part of the lower jaw is called the condyle.
So this is the part of the examination where the patient assessment is being given, and one of the things that I typically do is review their panoramic image, specifically what the joints look like. And oftentimes if they have arthritic change, the top of the jaw will be remodeled. Instead of being nice and smooth and rounded, it becomes flattened. And that's what forms the ball portion of that ball and socket joint. And the head or the top of the condyle ordinarily should be fairly smooth and round. This part of the assessment is to explain to the patient what the rationale is for treatment. Oftentimes patients will become overly focused on joint sounds, and in reality the rationale for treatment is to treat pain, locking, loss of range of motion. And so absent one of those three things, we don't treat joint sounds in and of themselves. There's a little bit of flattening there, but you can appreciate that that's fairly smooth and rounded. See that over there? See the little stair step?
I do.
Okay. That condyle has been remodeled. It could be one of two things. It could be degenerative change or arthritic change. Degenerative is just a fancy word for arthritic change. Or it could be if your jaw joint is hypermobile. Now right now you're not opening wide enough for us to tell, but if before you had this problem you were hypermobile, as you came across the front of the socket here, you could have worn that. Either one. But the creation of that little stair step is what fosters the popping. So I'm not sure that we'll be able to change that. But the rationale for treatment is to treat pain, locking, and loss of range of motion. In other words, joint sounds absent one of those other three things we don't treat. Okay, so we're going to treat pain, locking, and loss of you don't have any locking, but you have pain and loss of range of motion. And we're going to talk about that a little bit more in just a minute. But I wanted to show you that first.
part of the assessment is when I explain to the patient what their range of motion should be in terms of what a normal range is. And a normal opening for an adult female would be 35, so if it was less, they would have a reduced opening. Lateral movements and front to back movements should be approximately 10 millimeters. So I want to explain to them whether their range of motion is within normal limits. Also, I want to explain to them about deviation on opening. Oftentimes, patient will deviate as an accommodation to pain. Ordinarily, when you open, you should be opening in a straight line, but patients that have limited opening due to pain will often deviate to one side or the other as a compensation for the pain, because oftentimes you can open a little bit wider with a little less pain if you deviate to one side, and most often that's the affected side. Also, I explain to the patient about pain and limited opening. And that's because the two of them usually go together. Pain is what usually limits your opening, and that's why physical therapy can be effective for treating this sort of problem, because once you get the pain level down, you can usually get range of motion back up where it belongs. Your opening is reduced. Average opening for an adult female is 35 millimeters, and that's measuring from the bottom of the top front teeth.
To the bottom.
And you open all the way. We measure the space in between the edges of your top and bottom front teeth. And 35 millimeters is an average opening for an adult female. You're opening 30, and you're deviating noticeably to your left. And that's pretty typical of people who have pain and limited opening, okay? Because deviating when you open is a way to accommodate the pain. In other words, you can open a little bit wider with a little less pain by deviating to one side or the other. Typically, you deviate to the affected side, which you are 2/3 of the time. 1/3 of the time, you deviate to the other side, but you're deviating to the affected side, which would be more typical, okay? But pain and limited opening typically go together. In other words, pain is what usually limits your opening. So if we can get your pain level down, we should be able to get your opening back up. You have pain, a little bit of pain in the joint itself, as well as this muscle. Although I suspect that your primary pain is muscular and this is secondary or spillover, okay? After I go through all of the different portions of the assessment, then I will provide my treatment advice to the patient. Oftentimes I'll recommend physical therapy, I may recommend an appliance, less often I may recommend other things, but I want the patient to understand clearly what my advice is based on the findings and our assessment of those findings. I would recommend that you see a physical therapist who's experienced in treating jaw problems. Once I give them my treatment advice, if it includes physical therapy, I explain to them the importance of seeing a physical therapist who's experienced in treating jaw problems, because the average physical therapist has little to no knowledge of these sorts of problems, and oftentimes if they pick someone out at random, they may have a disappointing experience with physical therapy. The last part's important because most physical therapists don't know much about jaw problems, and if you go to somebody that doesn't, you probably won't get much out of it. This is the person that I would recommend for you to see. That fellow right there, Corey Bice.
Okay.
He is right across the street.
Oh,
Okay.
that's easy.
I would like to see you again when you're finished with physical therapy.
Okay.
And typically that's a few weeks, but he'll know when to send you back.
Okay.
That's when I want to see you again, and then we're going to talk about how you're doing and where we want to go from there.
Okay, do you want me to keep taking my muscle relaxant at night?
Oftentimes patients will ask about muscle relaxers, since a big component of facial pain patients is sore muscles. And in my experience, it typically doesn't provide prolonged relief, and most patients, if they have pain during the day, find that it doesn't allow them to function properly during the day. So I don't use muscle relaxers a lot in my treatment of patients. Most people find that they really can't take them during the day. They kind of tend to zone you out a little bit.
I haven't tried, but yeah, I heard
Yeah.
that. So.
Okay. This
Thank you.
That's a sheet that talks about some do's and don'ts for you for your jaw, things you should do to help it, things you shouldn't do that will aggravate it, and the things on the list are prioritized. So more important things are at the top of the list, and less important things are at the bottom of the list.
I didn't realize that. Thank you. Okay.
Are there any questions that you have?
He'll let me know how often, how long. He'll let me know
Typically, it's 4 to 6 visits over a few weeks. That's just a typical course, but obviously he'll cater it to what your needs are. But he'll let you know that when he sees you the first time.
All right, any other advice?
I think that's about it.
Thank you so much.
Okay.
I appreciate it.
All right. Let's get you on your way, and hopefully we'll see you back here in a few weeks or so.
Well, thank you.
Okay.